From Sarasota Memorial, this is HealthCast, a healthy dose of information from experts you can trust.
Hi everyone, welcome to HealthCast. I'm Allison Gottermeyer. Thank you for joining us today as we discuss the importance of getting back out there and healthy living now that we're seeing the end of the tunnel, so to speak, of this COVID-19 pandemic. Our guest today is Dr. Kirk Volker, a critical care pulmonologist and the medical director of clinical research here at Sarasota Memorial Hospital. Dr. Volker, thank you so much for joining us.
Oh, thank you for having me on as one of your inaugural podcast members.
It is so exciting to be here in the new Deb Kavanaugh studio here at Sarasota Memorial. And Dr. Volker, we know this has been a challenging 14 months or so
Absolutely.
for so many people in our community. But even those who didn't have COVID-19 or weren't impacted directly by the virus still faced health challenges. So can you talk to us a little bit about how some of the lockdowns and working from home have directly affected people's health right here in our community?
Absolutely. And I appreciate the fact that you're giving me the opportunity to talk about this, because right now is a critical time to talk about it because everybody has been cooped up. They've been inactive. And many experts have equated inactivity with the negative health consequences significant like smoking. That there's the impact on your body of just not getting up, moving around, the social isolation is as bad for you as smoking. And as a lung doctor, I do not say that lightly.
What is most concerning about this to you? And what are some of the long-term effects we can see if people don't start to get back out there?
Sure. Well, if you look at inactivity, and the worst thing is that you are now in that habit of not doing anything, of being a couch potato. And so the worst thing that happens is that you continue this habit, that you don't make a change now. You know, right now the weather's beautiful. There's no reason not to be outside. But if you continue that, then the increase in blood pressure, increase in your lipid profile, increase in your chances of heart attack, Alzheimer's, you name it, your risk for all these diseases goes up with inactivity.
So we always encourage people to live healthfully, of course, year round, not just now.
Right.
But it's especially important right now because people have begun to get vaccinated. They're able to get out safely. So what's your initial advice to people?
Yeah, is that this is the inflection point in your life. What decisions you make over the next couple of weeks, couple of months, will depend and determine how you do for the rest of the several years. So by getting out and starting good, healthful habits right now, you can make a huge change in your life.
So what are some of the initial healthful habits, as you say, that people should get started with right now?
Yeah. So the fundamental core principles are exercise, just getting out and walking. It doesn't have to be doing 10,000 steps a day. It may be just walking for 10 minutes a day. Nutrition, watching what you're eating, taking care of your body better through nutrition. And then now that people are getting vaccinated, community. Community is so important. One of the things that we've learned is that with this isolation that we've had, people don't have the physical touch, the actual in-person communication. Zoom can only replace so much, and now that we're getting out and actually talking to each other without masks, like we are, look at this. It is just so wonderful to sit and actually dialogue with somebody. And that sense of community is just as important as the exercise and nutrition.
And so many people in our community, especially many of the retirees prior to the pandemic, had things like walking groups with neighbors. And of course, that all stopped for fear of the pandemic. Right. People should be getting back out there, right?
Absolutely. And it's time to get those walking groups started back up again. Going and visiting your neighbors, assuming that everybody's vaccinated. Yes, and time to go outside and enjoy this wonderful environment that we have and celebrate the fact that you can go outside.
And so many people, even if they don't go outside, maybe they're not comfortable with the humidity or allergens or whatever it may be, they also were going to the gym. Gyms were closed, or even when they weren't closed, some people were still very uncomfortable going to the gym. If you're vaccinated, is it important to go back?
Yes. getting back into healthful routines is important. It's as important as stopping smoking. And if you're not going to the gym, if it's too hot outside, too humid, allergens or whatever, malls. Malls have been decimated by COVID-19 and the lack of retail shopping. So if you get back out, start walking the malls and maybe support a couple of retail businesses.
Now, you talked about how it can increase blood pressure, affect weight, fat. How can that have a long-term effect on the body? We talk about it looks like smoker, it's just as damaging as smoking, but what are some of those long-term effects that you see?
Well, okay, so the long-term effects are, high blood pressure, high cholesterol, which leads to heart attacks, strokes. Inactivity can actually advance cognitive decline, lead to dementia. So there are a lot of things that being inactive can promote. But I'd like to flip it around and talk about it once you start becoming active, taking care of yourself, what can you prevent?
And that's so good for your mental health as well. You kind of touched on that,
Yeah.
but that sense of community is so important.
Oh, it is. It is. And it's not easy to get these things started again. It takes a little effort, but the effort will pay you back, tenfold.
And Sarasota Memorial is also right now trying to encourage employees and healthcare workers who have worked so tirelessly during this pandemic to start taking care of themselves even more as well. So can you tell us a little bit about the new Renew program?
Yeah, that's, the thing is that our healthcare workers give so much of themselves and they put themselves last in that list. And so now what we're doing is we're encouraging them to take care of themselves. And we have, over the last 2 years, through the generosity of the Sarasota Memorial Healthcare Foundation, we've been able to institute something called the Renew program. And that is a way to restore and empower yourself through nutrition, exercise, and wellness, RENEW. And it's based on the Dean Ornish program. And that has the pillars of strict vegan, vegetarian diet, strict exercise, 6 days a week, meditation, and community. And what Dean Ornish program has demonstrated is that people with coronary artery disease, strokes, they can actually decrease their coronary artery disease through healthful living like that. Now, most of us don't need to be that restrictive. So what we've designed is a program based on moderate exercise, Mediterranean diet, preferably plant-based with a little bit of protein of your choice, mindfulness, still with meditation, and community. Again, that community support is so important. So based on that, we're able to offer this to the SMH employees and who are at risk for cardiovascular problems, hypertension, and things like that.
And you mentioned that this has been going on for some time, especially here at the hospital. And so we had smaller pilots similar to this prior to the pandemic. Can you talk about some of the results you saw from this?
Oh, sure. And it's and I forgot to mention that Dr. Chippy Naluri, who is in charge of the Dean Ornish program, is also the co-director of this Renew program with me. And it is just so gratifying to see once people go through this. We've had people come off of their insulin, come off of their blood pressure medication, improve their cholesterol. And those are metrics, but just to see how this can transform somebody's life, and their attitude and the weight that this job puts on them, is lifted by them just starting to take care of themselves.
And especially after this pandemic, when healthcare workers faced so many challenges, they've got to take care of that mental health as well.
Yeah, absolutely. And taking care of your physical health, taking care of your mental health, that just, it's one foot in front of the other. By making one little change, it's easier to make the next change, easier to make the next change.
What are some of the things that have been done in the past to get employees involved?
We've sent out recruitments, and initially there was just a smattering of people involved. And the most useful technique to get people involved is to have people who've gone through the program talk to their friends and coworkers, because they are so jazzed about it, so excited that it's contagious.
So many employees might be watching or listening and thinking, I should check that out. We hope they are, of course.
Absolutely.
If they want to get involved, is there still an opportunity?
Oh, absolutely. We're going to be enrolling employees quarterly, and we're going to be taking groups of 30 employees every quarter. Right now, because of the pandemic, we've learned how to do this virtually. It was requiring the employees to come in and sit down with us, but now we're refining our technique and able to do this virtually.
Now, Dr. Volker, not everyone in our community, of course, is an employee of Sarasota Memorial. Is there an opportunity, or will there be in the future, for community members to get involved?
Absolutely. And that was the whole design of this program, is that we would offer it first to our employees, which would be, the central group as we're trying to refine the program. Over the next year, I would like to bring it out to the community so that, community members, we can help with high blood pressure, dementia, stroke, heart attacks. That's the whole thing, is if we can touch hundreds or thousands of lives, now we're making a big impact.
But of course, we don't want anyone to wait a year. We don't want anyone waiting for the Renew program to come out to the community. How can people implement some of the things that are a part of this program immediately?
That's a wonderful question. And as I said, now is the inflection point. Now is the time when you're able to go out and feel comfortable. So now is the time to make that change in your life. First thing to do is set up a routine, okay? And start out with walking. All right, it may just be 7 to 10 minutes a day. That's all I'm asking. But if you set that up as a daily routine that you do 5, 6 days a week, after about a month, it takes about 25, 30 times of doing things differently in order to change a habit. So after about a month, that will be your new habit. And once you make one change, it's easier to make the next change. And then the next change that I would suggest looking at would be nutrition. All right. And to put it in a nutshell, the more vegetables you eat, the better. The less processed food, sugars you eat, the better. And so if you start making that change, making that plate a little bit more green, that will become your new normal. And that is a great way to make those changes. And then community. Start getting yourself involved in community. Stop isolating, that social isolation that we've all been doing. Time to get involved with community. And if you can give to someone else, you will get back so much more just by community participation. And so those 3 things are what I would say to start out with.
And this is an opportunity for anyone watching or listening, not just to do it for themselves, but encourage their neighbors, their family, their friends, people who live in the household with them. Guys, we formed some bad habits during this.
Yes.
Let's go.
Yeah, as a matter of fact, we're in the process of working on something called the Villages concept, which is neighbors helping neighbors as they age in place. And that is the core of that, in that having a neighbor say, come on, let's go for a walk. Not only are you helping yourself, but you're helping your neighbor. And then they will reach out and help somebody. So yeah, it's a multiplicative effort.
And once you start with those little steps, it's only time before you're making bigger steps. You're feeling healthier,
Absolutely.
Looking healthier.
And it all starts with one little step, and don't try to get this huge bite of it. Just a little bit of a change is enough.
Dr. Kirk Volker, thank you so much. We're looking forward to seeing the positive impacts on our community.
My pleasure.
As always, we are encouraging everyone in the community to live healthfully, be safe. We're not quite out of the woods with COVID-19 yet, so if you haven't already, please make sure to get your COVID-19 vaccine. This is our shot. Let's take it. So have a great day.